This is Leela, Dr. Sutton's personal dog, who presented for really stinky breath and was found to have a fractured tooth. She was here for her dental, so we sedated her, and then the girls placed an IV catheter. You can see that happening here. They tape it in and secure it, and then we just make sure it's flowing well. And after this, she'll get some more sedation so we can intubate her, and that means we put a tube down her trachea so we can make sure she's breathing well and she can get gas anesthesia during her procedure to keep her nice and sleepy. Here they are securing that tube in place so it doesn't fall out during the procedure. Now they will connect all the anesthesia monitors in place so we can make sure she's doing well throughout the procedure. Dr. Sutton then does a maxillary nerve block to make sure she doesn't feel any pain while he is extracting that tooth, and he will take over from here.
Looking here, you can see the issue. This is the largest tooth in the dog's mouth, is the carnasial, or the premolar. What's happened here is called a slab fracture. So that is a vertical fracture of this tooth, often from chewing on hard things such as bones, rocks, antlers. That torque causes that fracture to go straight up, and in Leela's case, it's caused an infection. I took an x-ray of that slab fracture tooth, and you can see right here where the fracture is. It's actually going up the opposite side of the x-ray that's showing. You can see like that's all infection right there. Oftentimes too, what happens is they will get a swelling. We call it a tooth root abscess. So right underneath this eye socket will be a large pocket of swelling that kind of helps us identify if this tooth is bad. So, okay, making a gingival flap. I get some gauze. So this is the gingival flap. Opened that up, so now we can get to the roots. So what's covering it here is the alveolar bone that has to be drilled away to expose these roots.
Here Dr. Sutton is away the alveolar bone so he can get to those roots better and separate them. Once he has them separated, in this next clip you'll see that he can elevate them with a tool that we call an elevator. And this way they all come out nicely and intact. We really want to avoid leaving any tooth roots behind. So here he is elevating, using a little torque on that, just being gentle. And now here he is suturing that gingival flap closed after he got all three of those roots out. And then here is Leela the night of her procedure, and she is doing great and healing well, back to normal pretty much at this point.